Hello, I am Dr. Kamakshi. I am an ENT surgeon and head and neck oncologist at Pranaam Group of Hospitals, Hyderabad. I will be starting a series of small videos on some of the common ENT problems and conditions that I am seeing in my clinic. This is for the purpose of knowledge sharing and to alleviate some of your fears, especially regarding your children. The first video of this series will be on nasal bleeds. Nasal bleeds, especially in children, is very common during the winter months, especially in areas of dry weather. Uh, Use of the practice of steaming or saline nasal drops, which are easily available over the counter in most pharmacies, is generally very effective in preventing these bleeds when done 2 to 3 times a day. If the bleed continues even beyond that, please consult your ENT specialist. The next most common cause of a nasal bleed is the presence of an upper respiratory infection or the common cold, especially in the presence of any anatomical variations of the nasal septum, such as the deviated nasal septum or the septal spur. The treatment of the upper respiratory infection in the presence of a nasal bleed by an ENT specialist with appropriate medicines and nasal drops generally resolves the nasal bleed. The next most common cause of nasal bleed in children is nasal picking. This is because the mucosa of the nose in children is very delicate, and if the children get into the habit of picking their nose frequently, it becomes a common cause of nasal bleed and nasal infections in children. In the case of adults, another important cause of nasal bleed is high uncontrolled blood pressure. So, while nasal packing and certain nasal drops help to control the current episode of the bleed, unless the blood pressure is brought under control, the episodes of nasal bleed could keep recurring.